I'm Dr. Eddie Rodriguez, principal of CASMED High School, and I'm very excited and happy to see everyone here, especially Dr. Lyssa Ochoa, who's joining us today to give us some insight. This is, I think, as I posted on the chat, I think this is the first ever in the city of San Antonio to try a guest speaker lecture like this. So this is really, really exciting. I'm going to give you just a few tidbits that I have here about Dr. Ochoa before she speaks, so just so that you know who we have with us today. Dr. Lyssa Ochoa is a board-certified vascular surgeon who has been practicing in San Antonio since her completion of medical training in 2011. Dr. Ochoa grew up in Mission, Texas, along the Texas-Mexico border, and earned a scholarship to attend both the University of Texas Pan American University in nearby Edinburgh, Texas, which is now UTRGV, and Baylor College of Medicine in Houston, Texas. Dr. Ochoa completed medical school, general surgery residency, and vascular surgery fellowships at all of Baylor College of Medicine. Dr. Ochoa had her career to serving those areas that have been underserved in the past, specifically in the community engagement and education. In addition to the practice of medicine, Dr. Ochoa's primary goal is to reduce the number of diabetic amputations that occur in our community due to chronic diseases. The coronavirus pandemic we are experiencing has forced Dr. Ochoa and practice the SAFE Clinic to rapidly adapt to new and ever-changing restrictions, guidelines, and challenges while continuing the practice's mission of service to our community. Dr. Ochoa is also a great supporter of our school here at CASMED, and we're very blessed to have her as part of our team, especially to have her here communicating with so many kids from throughout the entire city of San Antonio. So welcome, everyone. Dr. Ochoa, thank you for doing this for our community and our kids. It's all yours. Go ahead.
Well, Mr. Eddie Rodriguez, thank you so much for having me here. It's an honor to be the inaugural speaker in this CAS Cafe. I'm hoping that I'm able to help you guys use this time in this COVID pandemic that is new and ever-changing for all of us to learn something and figure out how we move forward in a better way. So I'm going to start. I have a few slides just to kind of guide my talk. I'm so happy to see that we have so many students on here. So what I have right now up here is I wanted to talk to you about how we at the SAFE Clinic have, for the most part, are fighting back with this COVID pandemic crisis. Eddie Rodriguez said earlier that the goal of our clinic, the focus goal, has been to decrease diabetic amputation rates in the zip codes in San Antonio that have the highest rates. And so already we have many challenges in what we're trying to accomplish, and this COVID-19 pandemic kind of just added to the barriers or the challenges that we have. One of the pictures I have up there is of our front of our clinic. We all have had to take new protocols, new standards to be able to see patients in our clinic. And what you'll see is how a patient who comes to the beginning of my clinic and what we have there, and we call it our battle station. Our battle station starts with an interview with the patient, asking them about any symptoms that they may have, and making sure that they don't have fever, any respiratory symptoms of cough or trouble breathing. We also make sure that we have sanitation protocols, and you'll see we have some hand-safe bleach that we make every day to make sure we're wiping down all the surfaces, all the high contact surfaces. We take their temperature and we actually hand them a mask. And so we want to make sure that as we're seeing our patients during this time, we're still doing it in the safest way. And so in the last, 3 to 4 weeks, we've all been posed new challenges. And some of the new challenges that we've had at the SAFE Clinic is creating all these new sanitation protocols. We were always making sure that we washed our hands, but we've all learned that the COVID-19 virus can live on surfaces for several hours and even maybe some in days. So making sure that we have sanitation protocols for doors, for doorknobs, for the chairs where our patients sit, we've adapted that very quickly. And part of the way we've done that is we've created our own hand-safe bleach that we use every day. And we have a little spray bottle and a wipe rag for all our staff to make sure that all those high contact areas are being sanitized. We're also now not only in front of the clinic, but as we schedule the patient's clinic visit, begin to screen patients for any of the COVID symptoms that we were talking about. Also, now in this new time when we're trying to do social distancing, we've had to adapt to telemedicine. And so telemedicine in itself is a fantastic thing. It's kind of similar to what we're doing now. You can see me, I can see you, and we can talk about symptoms and signs. And sometimes I even have the patients show me a video of their foot or the wounds that I want to look at. But as you can imagine, the population that I'm serving already, there are some challenges even with telemedicine. And so we've had to adapt what telemedicine means or televisits means to our patients. What's also been important is making sure that when our patients come to our office that we're keeping them safe, as well as my office staff. And so whether it's the sanitation protocols, whether it's making sure that our waiting room, they sit more than 6 feet apart, or having patients wait in their car, and we actually have a pager system so that they don't have to be in the clinic with many other patients around. And so we've been trying to figure out how we take these new challenges on every day. Outside of the clinic, I can tell you that the hospital, the care in the hospital, and that whole hospital environment has completely changed. And I worked in 4 of the hospitals in San Antonio, and that whole new hospital environment has been a challenge as well, because we know that the governor has mandated that we should not be doing any elective surgeries and only urgent surgeries. And so defining what that is and being able to figure out for each individual patient who can wait for their surgery or who needs the surgery now anyway. Like I mentioned, these are all new challenges that we face in the communities that we serve. But this adds to the pre-existing conditions that we have here. The high diabetic amputation rate that we know we already have. Social determinants of health for our patients, or those limitations of transportation, health literacy, access to food, are just compounded. Limited access to internet, that's a challenge for our patients then, and even now we see how that can even affect or limit their access to care, especially in this time when we're transitioning to telemedicine. And some offices, it's really the only avenue to get any kind of care. And then, no matter what, there are always going to be patients that need to go to the hospital. Before and even now, adds to the challenges that we've had. And so I sent this map out. I'm not sure if the students had a chance to study this map. This map is a map of the zip codes in San Antonio with the highest diabetic amputation rates. And the darker the blue, the higher the rate. And I've pointed out the highest ones with those 3 arrows, 782, 01, 07, 37. And this map is actually what has guided me to put my clinics in San Antonio. The highest zip codes is where we physically put our clinics so that we can at least acknowledge that barrier of transportation. If an office is 10, 15 minutes closer to a patient, the likelihood that they can get there is easier. And so I actually have 5 clinics in these zip codes where the darkest blue zip codes are. Now, this is another map I sent to the students. So this is a map that kind of gives an overall idea of social determinants of health, but it's called the Hardship Index. And it measures things like poverty, education level, crowding in the house. And so when we're talking about social distancing, crowding in neighborhoods in the home, you can just begin to imagine what kind of challenges these communities are going to have. And so it's no shock that the previous map, where we had the highest diabetic amputation rates on the west side, urban core, and the south side, are the similar ones that have these hardship index that are higher. And so what I'd ask the students to do is we already know that they have these barriers, but in this time of COVID-19, what anticipated additional challenges you think that this population has? And I've also asked the students to come up with ideas or suggestions on how we begin to fight those barriers or those challenges, so we make sure that this community, this disadvantaged community, this very vulnerable community still gets taken care of. And so when we all got presented with this new COVID-19 pandemic, and I was trying to figure out what I need to do as the CEO and leader of the Safe Clinic, as well as the care of my patients. What I began to realize is I am used to making sure that when I make decisions, I get all the information I need to make the best decision possible. And what I began to realize that I had to do was to make a decision that day with the information that's provided. And so realizing that day to day, that decisions may change. Also, that was challenging, and one thing we had to do is to rapidly changing guidelines. We have guidelines from hospitals, we have guidelines from our local, our city and county, our state, our federal mandates, whether it's the governor, whether it's through the AMA, the Texas Medical Association, Texas Medical Board have recommendations. My own Society of Vascular Surgery is making their recommendation and guidelines, and being able to use all this information and guidelines from different areas and bring them together to make the best decision for our patients in this area. And so the other thing we had to figure out, and one thing that I was concerned about, is in our patients who already have difficulty in access to healthcare, is I was worried because I saw some offices limiting hours, offering only telemedicine, which we know is difficult for our patients who don't have access to internet, who have flip phones. Another challenge I found was some of our patients have the prepaid phones that don't have enough minutes to be able to video chat. And so how do we maximize the care while minimizing contact? And so what we have done is train or educate our patients, one, how to use telemedicine. We actually walk step by step with them on how to log on, click on the links appropriate, and help them begin to learn. Sometimes the first time they've ever used a camera on their phone. We also, if they can't do that, we still make sure we call them. Sometimes just being able to verbalize what their symptoms are and talk to them, we can decide, is this a serious problem? You need to come in and see me, or you're okay and we can put your clinic visit back. We've also monitored wounds just with pictures. We have them send us pictures of our wounds so we can monitor the wounds weekly. My concern when this all started was that our patients already having barriers to access to care, on top of the fear or the anxiety of the COVID virus, would not seek help when they needed it, and that they may end up with worsening complications of their underlying medical conditions, and they would end up in the hospital nonetheless. And so what my office has done is try to reach out to patients, not only via telemedicine, but telephone, anything that we can to make sure that they know we are still here for them to take care of them, and that there are doctors here to take care of them in the safest way possible, and to kind of ease their fears that they need to make sure they still manage their medical problems during this time. The other thing that was very important to me, and another thing I had to think about, is making sure that I have 20 staff, that I prioritize their safety and the wellness of my staff. And so making sure that they had everything they needed to keep themselves safe and their families safe. What I realized is that if my staff weren't able to take care of their family, then they can't come to work and help me take care of our patients. So one thing from a business standpoint, we made sure that we took advantage of all the small business loans and other funding mechanisms to make sure that we can keep our staff employed, keep them safe, keep them well, not only to help take care of our patients, but to make sure that their families are okay as well. And so one thing I've also has been important to me during this time, like I've already explained, is that there are still communities and patients and people out there who don't have a voice in this during this period and don't have access to help. I'm going to give you an example. We have started sponsoring help with a Southside business coffee house who have transitioned their business to deliver food, dry goods, and what I donated toilet paper. We all know how we've had trouble getting toilet paper, and delivering it to the elderly who don't have transportation, who can't get in line at the food bank, who don't have anyone reaching out to them, because we have those in the community that don't have a voice. And so I've been trying to use this time to amplify our voice on behalf of those that we don't hear, because they are there and they're the most vulnerable who need to be taken care of. And so when I mentioned before that we're making decisions with limited information daily, and so what I have learned to do as a surgeon in my training is to prepare for all scenarios. And it's how I go into surgery myself. I have a plan A for a best case scenario, a plan B for not, and something for a worst case scenario. So prepare for what can happen in every scenario. And so I've used that strategy, and like I do in surgery, into how the clinic is managing our patient care now, preparing for every situation, the best situation, the worst situation, and we can make sure that we have everything in between covered. So I believe that preparing in advance for all scenarios brings stability to the practice. It brings stability and confidence to my staff, and that way that can be translated into confidence, stability, and genuine care for our patients as they come into their clinic if we need to, or via telemedicine. But I'm hoping that that is kind of a brief overview of how we have been tackling this COVID pandemic. I imagine day by day things are going to continue to change, and we're going to continue to adjust. I guess now is a good time if the students have any questions.
Perfect. Okay, so question by Aaron Patino. Why is the combination of diabetes and COVID-19 such an elevated threat?
That's an excellent question, and there's been a lot of questions that the community has had. You know that our population in San Antonio has a very high diabetes rate, like 14% in the county, but focus in those zip codes, even higher percentages. And so when I heard this, the first concern my diabetics had was, am I more at risk to have the virus or to get the virus? And so the good news is no, our diabetics are not at risk to be able to get it. But what happens is, if they do acquire the virus, those medical conditions like diabetes, like high blood pressure, heart disease, kidney disease, which all go hand in hand, they put that patient more at risk for more complications if they have the virus. And so it is that patient population that needs the education even more, of hand sanitation, of wearing our masks, of social distancing, of making sure we don't touch our faces. They are the ones that we want to make sure understand the importance of those safety and sanitation protocols so that they don't put themselves at risk of getting the virus.
Thank you, Dr. I have another question from Jean Russell. If anyone is living with a family member who has diabetes, is there anything they should be doing differently to help during this time? I think
that's a fantastic question. And so, like in any thing, our family are our cheerleaders. They're there to take care of us. So one thing that family member can do is make sure that they themselves take those precautions, hand sanitation, staying away. Also being able to make sure that the diabetic patient has everything they need as far as diabetic supplies, testing, monitoring their insulin if they take insulin, their medications, and being that go-between so that they can go to the pharmacy or HEB, wherever they need to get that, and bring it back to their family member. Again, being that support to get them what they need and limiting their outings or social interactions, and making sure that it's done in a sanitary way.
Thank you so much, Dr. Ochoa. Another question from Saida Maldonado. Is COVID-19 like the flu, where you can catch it more than once?
The real answer to that is we don't know yet. I think we're still trying to figure, this is a very new virus, and we're trying to figure out whether that's possible. I've been reading, I'm sure we're all reading. We don't know if just because you test for it again when you were once negative, does that mean you have the virus and can get sick again? Or does it simply mean that that test remains positive for a period of time? I imagine in the next few weeks, I know all our researchers and our scientists are trying to figure this out. And with the more time that we have doing research in this virus and getting to know it, we will have the answer to that question.
Okay, thank you so much, Dr. Now all the questions are flooding in. Give me 1 second. Is the coronavirus more serious than cancer or the flu? by Mariana Olivares.
Excellent question. I think you probably have heard how some people were initially comparing how the flu affects more people versus coronavirus, and there is a big difference between the flu and the coronavirus. One of it is that none of us, because we had never seen this virus, have any immunity to it. And so what has been happening while we have this pandemic is where usually the flu, we get, it's seasonal, we get it throughout the year. With this coronavirus, it spreads so quickly, and we have rapidly increasing patients that get coronavirus, and we're still trying to figure out what the mortality rate is or what the risk of death is with it. I think you may have probably heard, I saw this on a graphic, that they've been measuring weekly mortality with all our different chronic conditions, such as heart disease, such as cancer, and now with coronavirus. And I think I saw a graphic recently that said in the past week that deaths for COVID have reached a higher rate than even heart disease and maybe cancer. And so I don't think that this is a long-term thing. It's just what's happening at this point in time. But like I said, and we all are learning, day by day, week by week, things change. We have taken this virus on, and we realize that social distancing, sanitary precautions, and what I imagine is going to happen is that that map or that graphic of increasing patients is going to level out and eventually come down. And when that happens, then the weekly mortality rates are not going to be as high as I think some of the media has said it is.
Okay, thank you so much, Dr. Ochoa. Another question by Eddie Rodriguez. I'm not sure which one either, Dr. Rodriguez. Some people are making their own masks and using them out and about. How effective are these to the virus?
Excellent question. And so I'm sure you all know that the city and the county has just mandated that anytime we all go outside and can't social distance, we should be wearing some kind of covering over our face. For the medical professionals, we have surgical masks, and for people who take care of the COVID-19 patients, it's a very specific N95 mask with filters and seals. That certainly is not needed for the community. And what we're trying to do is a mask doesn't, or a covering of the face, or cloth face doesn't protect you, it protects others. So when we sneeze or we cough, and we call this the droplets, that gets limited when someone wears something over their face. And so that helps to protect any people around a person wearing a cloth mask. We also know that if someone else is also wearing a mask, if both people are wearing a mask, the risk to acquiring that virus is definitely less, which is why there's that mandate now. We also know that the virus is sometimes, in some healthy people, is asymptomatic. People have no symptoms and don't even know they have the virus. And that's why all of us wearing some kind of covering over our face, we're all doing it, then the risk of transmitting any virus or unknown person who has it virus is reduced significantly.
Okay. Thank you, Dr. Ochoa. I think this will be a follow-up question from another student that kind of pertains to the question that I just asked. From Priscilla Rios, do you think that having more strict rules for face covering should have been put into force sooner?
That's a good question, and I'll be honest, I don't know. I imagine that as we get through this crisis, we're going to learn more and more. One thing that I have seen in San Antonio, for example, I'm talking to my colleagues in Chicago, in New York, who are really seeing the surge of patients, and we have not seen that here in San Antonio. And I was actually asking, I'm wondering if the social distancing we're doing now, and I'll be honest, you made me laugh a little bit. Sometimes I still see people at Target and Walmart. I'm like, is this social distancing enough? But maybe it doesn't have to be perfect, and it has to be just good enough. And that may be the reason San Antonio hasn't seen, as of yet, such the huge surge. We will see if with this masking now, is that going to change the rates of the COVID virus testing positive? I think the mask guidance is an example of making the best decisions with the info we have at the time. And so as I'm doing this for my practice, city and county leaders are doing that for the city and the county. And so as information begins to change, that's why recommendations are evolving as well.
Okay, thank you so much. I'm getting many questions now. Thank you so much, everyone, for participating. me see. Give me 1 second. I saw one about essential workers somewhere here. Okay, from Cambry. My parents are essential workers. How can we be more safe? How can my dad help his workers who don't have enough money to be checked?
So I'm in the same position as your parents, and so we thank them that they're working in this time. And I'm glad that you're saying we're concerned about his workers. And the same thing, making sure that we as employers model the actions we want our own workers to take, whether it's washing hands. So for example, I know we don't have enough hand sanitizers. And so what we did is we made our own hand safe bleach, which is very easy. It's very affordable. If y'all want the recipe, it's 2 teaspoons of germicidal bleach in a gallon of water. And so in a very economical way, we've empowered my staff to say, this is your tool. It's a little spray bottle with hand safe bleach and a rag that we wash daily to keep themselves safe and clean. And so I would recommend that as well. One thing that I have done, and I come home to dogs, but as soon as I get home, I change my clothes and I put them in the washer, and I separate kind of my work attire with what how I relax at home, or what I do when I get home. And so I think making sure that keeping the outside environment from your home environment, where I know some people have large families that they come home to, if we can keep that separate and safe and sanitized, that's another good strategy to keep the people at home safe.
Okay, and thank you so much, Dr. Ochoa. This will be the last question. From David Diaz, how long do you think the coronavirus might last?
Well, if I knew the answer to that, I would be on national TV. I'm kidding. I don't know. I've been following the models, and I've been following to see what's going on in San Antonio. We are expecting our peak to be around late April, early May. And that's just based, again, on the information we have today of what we think is going to happen. Now, I think you've all seen the curve model, where the curve that is like that, we want it to be more of a flat curve. And I did get a question once that said, this curve is going to prolong when people get COVID versus this curve. And that may be true. The advantage of the lower curve that may be a little bit more drawn out is that we will have the resources, the PPE, the hospital beds, the ventilators, the staff to be able to take care of those patients so that we limit mortality rates. I do imagine that the changes that we're making now is probably going to affect us long term, and not just in this acute pandemic. I think how we live our lives and how we make sure we care for one another is going to change from here on out. So if in that regard, I imagine this is going to be lifelong changes and adaptations to the lives that we live. But I hope that answers your question. I know it's not just a steadfast heart answer, but with more information, we'll be able to better answer that question.
Thank you so much, Dr. Ochoa, for answering everyone's questions. I know there was many more questions. Unfortunately, we don't have, we're on a crunch time and we can't answer every single question, but thank you so much to everyone for participating. And again, thank you, Dr. Ochoa, for all your answers.
Thank you. It was a pleasure to be here with you guys. Stay safe.
Dr. Ochoa, I do have one more question as we close the loop. Any advice that you would give our students and our educators as we continue?
Sure. I think keeping yourself abreast of what's going on, making sure that you understand what's happening in the COVID pandemic and why. I think one thing that's important for us too is how can we help? And so I've had that question also. And so I would look to those businesses, nonprofits who have pivoted to take care of, like I said, our most vulnerable population. And so I would ask that you reach out to, whether it's the food bank, Meals on Wheels, those businesses, to see what we can do to make sure that we help that community out. If I was a student right now in high school and I was at home, I can only imagine what would be going through my mind. And so one thing that I think would be very important is to make sure that you continue your education through this process. You have an advantage. We have internet, we have webcams, we have webinars. And so there is no reason that during this period of time where you're stuck at home, that we cannot continue that education. And so I think this may be, it completely evolve the world of education, where now this is actually a means to bring education to even a broader community rather than just people who can physically go to a college or to a high school. So you all are going to brave the way on how we provide education for more around this city, this county, the state, the country in a very economical way. So I guess the other thing that I wanted to make sure happens is if any of you all know another student who does not have the resource to stay connected like we are today, to ask them to ask for help, or you encourage them to ask for help. Because I imagine that there are other students who don't have internet or don't have a computer and don't have this access. Let's figure out who those students are and make sure that we help provide them a way to stay connected during this time.
So thank you so very much. Extremely grateful for everyone, and we'll talk soon. Let's keep in touch. Adios.